Professor Lahane sir, who is living legend of SICS and does hundreds of cases every day with Professor Ragini Parikh. So they are doing wonderful job, and you will learn the Bluementhol technique from him. Bluementhol, as you know, is the father of SICS. All of us learned from him. Thank you, sir. Dr. Lahane sir, please.
Thank you, Kamalji Singh sir. I trained myself with Dr. Bluementhol in 1996. I was there in Israel for 1 month, and Dr. Bluementhol came to JJ Hospital 3 times, and he demonstrated his technique of the SICS in the Mumbai. Now this is the incision. It is very important whenever you are thinking of the incision. So there are 2 parts of the incision. This is the external incision, and this is the point of astigmatism. It should not be more than 5.5 millimeter. Then this is the internal incision. This will never take part in the astigmatism if it is in the cornea. If it is not in the cornea 1 millimeter, then again it will cause the astigmatism. So whenever you are going in, you must cut the cornea, and that will not give rise astigmatism if you make it 7 millimeter also. So it means whenever you are going and opening inside, it should be in the cornea minimum 1 millimeter inside the limbus. That will help you to reduce the astigmatism. And so this is a self-sealing incision. So whenever you are making the incision, it should be a self-sealing wall incision. And so in the Bluementhol technique, what is done? Here the polypropylene glide is used, and this glide helps and supports the removal of the nucleus. So you can say price is maybe 20 rupees, and you see this the small pupil, non-dilating pupil here, and now see, basically you will see the conjunctiva. See, you do slightly large conjunctival flap. Why? Reposition is possible. If it is a small, it reflects behind, retracts behind. So if it is a larger one, then it will, you can say this, it will stick to the other conjunctiva and it will not come out. So larger flap, why? Away from the lid margin. Whenever this lid margin is closing, the flap should be away from that. If it is away from that, then that will not get retracted by the lid. So larger flap. See, this is the old video where I am not using the Blu-rays for this. I have not stained, and if you will see, I am doing the rhexis. Here I am taking the support of iris, and rhexis is done behind the iris. Rhexis is done behind the iris. And now see here, while going in, you cut, and extension, see here. And once you do that, then by the dialer, I am just bringing the nucleus, and here now see, I am going in, see here, and by the cannula, I am rotating the nucleus from the pupil. So, and once it is, now see, this is a glide supported, and just can see, once you see the tip, edge of the nucleus, it means your tunnel is perfect, because nucleus is engaged, and once it is engaged, then only edge of the nucleus is seen. And once it is seen, then you can see I have removed everything, given subconjunctiva, and see this. Reposing of the conjunctiva is very important whenever you are doing the surgery. Now here it is a brown cataract. Now see, again I am doing this, see here. Slightly away from the black zone of the limbus. Slightly away. Why? How much you go away, that reduces the astigmatism. Should go 2 millimeter away, 1.5 to 2 millimeter, not more than 2 millimeter. If you go more than 2 millimeter, then it will be very difficult, because that is the longest tunnel, and nucleus will remain inside the tunnel. So now here you will see, again I am doing the rhexis, and the Again I am completing the rexis. So here I have completed the rexis. Can you see this? And once that is rexis is completed, now see here. While going in, you cut and you can see always in the cornea. See here, the cornea, and because of that the astigmatism is reduced. So once I have done that, then what I will do, see here, the glide, and just I will hold this tunnel and see that black nucleus has came out. So it is possible to remove such type of any type of nucleus in the SICS. See here again, you can, this is the aspiration cannula we have developed, and by that we can, this is a sand polished cannula which so this is the another case, another, what has happened? Now see, this is a black cataract. See now the cataract. Now this cataract, if you will do by phaco, then your life will be reduced by 1 month. So this is very hard. Now you can use the femto, and after that you can do after that also it is difficult to do such type of cases. If you have got the femto, then you can definitely go for phacoemulsification by femto. And I will tell you, those people who are having such type of cataract, they are poor people. So they can't pay for the femto. So that is the problem. So it is better to go by the SICS. Now see, this is the black cataract. And this type of black cataract, if it is comes and if you want to do the phaco, then really it is very difficult to do this type of cataract by phaco. See here, and can you see this? It's so black, so many leathery fibers behind, and that can be removed very easily. And second day, the cornea is transparent, and patient is having will have the good vision. So always better to remove such type of cataract by SICS. So once such type of cataract comes to you, do SICS, and you will be happy second day. Patient will be also happy second day. And then the hypermature cataract, if it is there, now here you will see, I'm just to demonstrate, I'm telling you, in this you can see the calcified capsule. Sometimes it is not possible to do the rexis. So what we can do the envelope technique, or we can remove the lens, and after that you can do the rexis. See here again, you can see it is a 5.5 millimeter tunnel. So very, very important, whenever you are making any tunnel, you must take care of the tunnel properly. Make a pocket. See here, these are the pockets, minimum 1.5 millimeter on both sides pockets are there. And once that is made, then you will see here again, can you see this going in the like a dimple here? So very, very important. So whenever you are entering a dimple, you keep in mind. If it is a dimple is there, yes, you are in cornea. And then you can just extend it. Here again you will see and then it is a parallel to the limbus, and I have extended. Now see here, I am just doing the envelope technique because of all the anterior capsule is fibrosed. So I may not be possible here to do the rexis, or I may pull the zonules. And to avoid that, now you see, I have done now see here, and once it is done, the anterior chamber is maintained, and then by the glide, you can see this is the glide, and once you can see the edge, the nucleus is going to come. See here, it is a hard nucleus, and then I am putting the lens behind the anterior capsule. See here, this is the old video of 2008. See here, and you can see the fibrosis of the capsule. Now I am cutting the capsule, and after that you can see this, I am doing the rexis. See here, the rexis is done and lens is in the back. So it is possible to do any type of cataract, and so SICS is easy to learn, easy to practice, and it is a skilled procedure to master it. Now surgery, first you can say from first surgery to last surgery, techniques remain same. And Bluementhol is very physiological technique. Everything, nothing goes inside because anterior chamber remains maintained. And now we are purchasing the phaco where we want to maintain the chamber. And chamber maintainer does the same work what the centurion is doing. So this is a small incision surgery AC maintainer chamber is a centurion for the doctors who are the practitioner. Just now they have started the practice. So chamber maintainer, AC maintainer. And then the preservation of endothelium is possible because of maintenance of the AC. So I think this technique, the most physiological technique is there. Thank you very much.